Hey, welcome back, everybody. We are back here at Roswell Park Comprehensive Cancer Center with Dr. Marie Quinn, the Director of Breast Imaging. And you know, we've been here before talking a few times about getting your mammogram here and things to expect once you get here and what it would be like. So, Dr. Quinn, it's nice to have you back.
Thank you so much. It's great to be back.
If we pick up on where we spoke about what we spoke about the last time, let's talk about having your mammogram here. We can expect that it will be a 3D mammogram. You don't have to ask for that.
That's correct. All of our mammograms are 3D.
And then once you read it, you can let them, because most of them are normal, patient can go home and you can always give them a follow-up call to let them know what you saw.
That's correct, Linda. We do have 30-minute express appointments so the patients can come in on their lunch break or whenever it's convenient, have their mammogram done and leave. And as long as they're a screening mammogram, you don't have any other issues that day, we'll call you with the results usually later that day or the next morning.
Okay. Now, what kind of questions should a patient ask in talking with the doctor after they get their results?
So on the result sheets the patient has, it'll say whether or not their mammogram is normal, and that's what everyone wants to see. Mm-hmm. And then there's another box where it lists whether or not the patient has dense breast tissue. And a lot of us know if we've had a mammogram before, if we have dense tissue or not. And the only way to tell if you have dense tissue is on the mammogram, not just by feeling the breasts or what they look like. The reason that's important is because women with dense tissue, it means the mammogram's a little bit harder to read because breast tissue is white on the mammogram and breast cancers also can show up as a white mass. Mm-hmm. So with breast density, we can give the patient some more information to talk with their primary care doctors about whether they want to do additional screening with breast ultrasound. With the 3D mammogram that we're doing, we already are picking up more cancers in all women with dense breast tissue and non-dense tissue. So that's the great news. Mm-hmm. But it's important to have that information and to know your breast density so that you know if your mammogram's harder to read.
Right. And of course, early breast cancer, very, very treatable. And we want people to know because there's still a lot of people under the misinformation that A, this is going to hurt, and B, they're going to give me bad news. But sometimes getting the news that you have a very early form of breast cancer can be a blessing.
That's so true. The treatments have gotten so much better. Like you said, most mammograms are normal, and I do try to emphasize that when patients are coming in. But if we are going to pick up breast cancer, we want to pick it up at the earliest stage on the mammogram before you can feel it when you have the most options for treatment.
And is that what you see most of the time?
Most breast cancers that we pick up on screening mammogram are we want to pick them up when they're small, less than 1 centimeter or 2 centimeter before they can be felt. Sometimes it's a little mass, sometimes we see calcifications. And if we do see anything on the mammogram, we'll talk to the patient and schedule a biopsy that's done right here in the office.
What do you consider a family history for someone to say, I have a family history of breast cancer?
So when the patients come in for their mammogram, we have them fill out a long sheet with all their history. And what we want to know is if you've had any first-degree relatives or second-degree relatives that have had breast cancer and at what age. Mm-hmm. And what sets off the flag is if we see multiple family members on the same side, then we do have a high-risk program here at Roswell Park where we can refer the patient to discuss their family history, their risk, and if they need any additional counseling or testing.
That's wonderful. And I know that you take all insurances, so people are just, please make your appointment and come on in.
That's correct.
Mm-hmm. All right. Also want to talk to you about that Roswell will actually even work with your schedule to make sure you can come in and have a timely mammogram.
We have appointments, I think, from 7:30 in the morning, and we have some evening appointments and also some Saturdays as well. If you call and talk to our schedulers, they can set you up for an appointment that will work for you.
That's wonderful. And, you know, if you haven't come on down to Roswell and seen this beautiful floor that they have dedicated for this, once again, you don't have to be a patient of Roswell to have your yearly mammograms here. And when you do, you can be assured of a 3D mammogram and having the best doctors take a look at this, people who are specialists in taking a look. And of course, if something is spotted, you will call the patient and let them know and then proceed from there.
That's correct. If we do see something on the mammogram and the patient's already left, we'll call them back and let them know if they need additional imaging. If it's something that really does look like it'll need a biopsy, we can coordinate that as well. We know our patients are busy, and we try to get you in as few appointments as possible.
Are we recommending if you have a normal mammogram to have it every year?
So we do follow the National Comprehensive Cancer Network guidelines, or the NCCN, which recommends yearly screening mammograms in women of average risk beginning by age 40. And that way we pick up the most breast cancers at the earliest stage, giving patients the options for the best treatments and the best outcomes.
All right. And we do want to remind everybody they have a beautiful parking lot here. They have a floor that's dedicated to this. You're in very good hands, and it will be a very positive experience. We can promise you that. Thank you, Dr. Quinn.
Thank you so much, Linda.
And again, please make your annual mammogram appointment right here at Roswell. Please give them a call at 1-800-ROSWELL or go online and do it today.